So one of the things I tell people is you actually get smarter when you leave the CIO role and you start doing consulting. And one of the reasons you do, and I'm serious about that, because you talk to a lot of different health systems. What do you know today that would maybe have informed the way you approach cybersecurity if you were still a CIO?
Excellent question. Something actually I think about all the time. I have the advantage of speaking to CIOs, dozens, hundreds of CIOs across the country, and it's eye-opening. Number one is where people are in their journey, right? So it's just amazing that we're not all, when I was a CIO, I was assuming, okay, so I'm kind of running with the pack or within the boundaries. And it's just, it doesn't ever cease to amaze me about the spectrum of where people are in protecting them. So that's number one, which I never realized. Number two is that there's a lot of learning that could be had just by opening up and joining in the discussions. And sometimes you stay local, right? So, okay, so I'm going to talk to the CIOs that are in New York, or I'll meet up at a Chime or a HIMSS event. But there's so much, sharing going on that it's almost like if people are not reaching out and they're not part of groups that are having these discussions through partners or through other CIOs, it's a shame because they're really missing out on, I wouldn't call it necessarily the free help, but it's one of those things where everybody wants to see everybody else be successful. So it's something I didn't realize. Another thing also is that organizations and maturity and culture really are very different in how they approach security. We're working with a hospital where we were talking to the CIO and the CTO and some others and talking about how to really fortify and protect everything. And then we had a conversation with the CIO, and the CIO goes, I'm sure my team's doing a great job. Here's what I want from you. I want you to tell me how quickly, when we get breached, can we get back? And I'm like, well, we're working with the team and we're fortifying. It's like, okay, when we get breached, how long will it take? So I want you to get me, what's my supply chain for extra desktops? Can we get staff on? So I wish I had known, and when I was a CIO, and even though it's only been 2 years, security was hot, but it's obviously not as hot as it is right now. I wish I had known how easy it is to get help.
I'm glad to facilitate some of these conversations. So we did the webinar with Skylakes and Asante, and we went through that in detail. I mean, this is what the first hour looked like, this is what the second hour looked like, this is what it took once they disconnected, because Asante was the host for the EHR, and they couldn't reconnect until they met certain criteria until they got back on there. I love the fact that we're starting to share some of that knowledge.